This is the Maryland Down Syndrome Advocacy Coalition, MDAC 2022 Voters Guide. MDAC Guiding Principles, Current Developments in Maryland and Questions for Candidates, Childcare and Early Intervention. People with Down syndrome and their families need access to high quality, affordable childcare and early intervention services. Children with Down syndrome typically face delays in mobility and/or communication. Therefore, early intervention services are essential to their development. Services from a medical professional or teacher can begin anytime after birth, but the sooner the services start, the better. For young children, inclusive environments with typically developing peers are critical. As Vanderbilt professor Eric W. Carter has said, early segregation does not merely predict later segregation, it almost ensures it. The fiscal year 23 Maryland budget includes $14.6 million for the Maryland Infants and Toddlers Program, a $4.3 million increase over fiscal year 2022. Question to ask a candidate: do you support increased early intervention budgets in Maryland? Do you believe children with disabilities should learn and play alongside children without disabilities?
Civic participation. People with Down syndrome are able to participate in all aspects of civic life, including accessible voting, contributing to legislative advocacy, and communicating their views, values, and beliefs. Accessible voting is critical for our community. Mail-in voting, early voting, and accessible polling places, as well as ballots, are important to us. We look forward to having opportunities to talk to candidates, to spend time with our elected officials, and to share our concerns in an effort to provide information about our lives to those running for office and representing us. We thank our elected officials and those running for office for their time and consideration of issues that are important to the Down syndrome and disability community in Maryland.
Education. Students with Down syndrome and other intellectual disabilities should be given opportunities for lifelong learning and a high-quality education throughout elementary, secondary, and post-secondary schooling. The Individuals with Disabilities Act, or IDEA, requires public schools to provide each student who has an individualized program, or an IEP, a free and appropriate public education, or FAPE. The federal government has committed to paying 40% of the average per pupil cost for special education, but has never met that commitment. Current federal funding is just 15.7%. Questions to ask a federal candidate: do you think that the Individuals with Disabilities Education Act should be fully funded at the federal level, as was promised when initially passed? In the 2020-2021 school year, less than 3% of Maryland students with significant cognitive disabilities who took the alternate assessment were included in general education classrooms for 80% or more of the day. More than 60% of these students were educated in self-contained classrooms, and 21% were educated in separate schools. Despite decades of robust research establishing the benefits of educating students with and without disabilities together, the trend in Maryland is towards more restrictive placements for students with significant cognitive disabilities. Questions to ask a candidate: how can we support general and special educators working together to create school communities and classrooms that provide the services and supports needed for all students to be successful? How can we support sufficient professional development so that school staff may be able to accomplish this work? The blueprint for Maryland's future includes increased allocations for special education to Maryland schools. Some districts, however, have flat funded special education by using these new allocations to supplant instead of supplement existing local special education funding. Questions to ask a candidate: will you stand with advocates who are seeking strong policy guidance, and/or a legislative solution to prohibit local school systems from supplanting rather than supplementing local funds with blueprint funding for special education. Over the last 5 years, when families have gone to due process because of disagreements with their children's school districts, families have only won 16% of the time. The cost of hiring attorneys and expert witnesses prevents many families from filing disputes, even when they are in the right. Questions to ask a candidate. When parents disagree with schools and need to utilize due process procedures, do you think that the burden of proof should be on the parents or the schools? Should parents be required to pay expert witness fees when they use an expert witness in a due process hearing?
Employment. People with Down syndrome and other intellectual disabilities can be successful in competitive, integrated employment when given appropriate support and opportunities. In 2020, Maryland became only the second state to eliminate sub-minimum wages for people with disabilities. We must continue to develop more opportunities for individuals with Down syndrome and other intellectual disabilities to pursue integrated, competitively paid employment. Question to ask a candidate. Do you think that all people with disabilities should have the opportunity to work at a real job with competitive wages? What would you do to increase work opportunities for people with disabilities?
Healthcare. People with Down syndrome need equitable, high quality, and affordable physical and mental care. Access to mental health care is a problem for many Marylanders, but it is particularly a crisis for people with intellectual and developmental disabilities. Many mental health professionals feel unprepared to serve this population, and many Medicaid recipients are unable to find professionals who will take on their care. The reasons contributing to this problem are complex, and tackling it is going to take collaboration, focused attention, and commitment. Questions to ask a candidate. Would you support studying this problem to identify solutions to increase access to mental health care for Marylanders with intellectual disabilities?
Home and community-based services. Home and community-based services, or HCBS, and long-term supports and services and supports should be readily available, easily accessible, fully funded, flexible, and implemented as soon as the need arises. Home and community-based services, HCBS, are important to adults with Down syndrome for them to live and work in their communities with the support they need. In 2022, the Maryland legislature passed the End the Wait Act. This law requires the Maryland Department of Health to develop plans to reduce the wait lists for all waiver programs by 50%, beginning in fiscal year 2024. More funding is needed to stabilize the direct support workforce and ensure a sustainable HCBS infrastructure. Question to ask a candidate. Do you support increased funding for home and community-based services and stabilization of the direct support workforce?
Informed choices. People with Down syndrome and other intellectual and/or developmental disabilities, or IDD, are able to make informed choices about all aspects of their lives. Individuals with Down syndrome have the right to make choices and decisions with support. In 2022, the Maryland legislature passed a law making supported decision-making an alternative to guardianship. You can learn more about the new law from the link directed to the Maryland DD Council. The Maryland legislature also passed the Self-Directed Services Act of 2022 that allows an individual to have choice and control of their Medicaid waiver services. Individuals can choose the staff that supports them and how their budget is spent. Question to ask a candidate: how can we ensure that these efforts to restore and protect the ability of people with Down syndrome and other intellectual disabilities to make choices about their own lives are successful?
Justice. People with Down syndrome and other intellectual or developmental disabilities deserve to feel safe, understood, and included in the communities in which they live. The Ethan Saylor Alliance for Self-Advocates exists within the Maryland Department of Disabilities to promote leadership by people with disabilities in the training of law enforcement and other public entities in Maryland. People with intellectual and/or developmental disabilities, or IDD, have the right to justice and fair treatment in all areas of the criminal justice system. Supports and accommodations may be required to make justice and fair treatment a reality. Question to ask a candidate: do you support the mission of the Ethan Saylor Alliance and the further development of policies and programs promoting fair and equitable treatment of people with disabilities when interacting with law enforcement and the criminal justice system in Maryland?
Transportation. All forms of transportation, including public transportation, provide a critical means for people with disabilities to access employment, education, healthcare, and community life. Mobility Link Paratransit, a service run by the Maryland Transportation Authority, provides transportation to people with disabilities who have difficulty using other types of transportation. Unfortunately, Mobility Link underperforms compared to other MTA public transportation services, such as buses, light rail, and the metro. Too often, riders are left stranded, are late to work, or miss medical appointments. Many riders only use Mobility Link when absolutely necessary because it is so unreliable and complaints are not addressed. Many adults in our community need this service. Question to ask a candidate: how would you hold MTA accountable for addressing these failures and living up to our state's commitment to people with disabilities?
Information for Maryland voters, November 2022 midterm elections. General information: Maryland Board of Elections, Maryland Votes 2022. This is the link. Important dates: the last day to register online or by mail is October the 18th. Early voting is October 27th through November 3rd from 7 a.m. to 8 p.m. Last day to request a mail-in ballot, November 1st. Election day is November 8th. Did you know in Maryland, we have same-day registration for in-person voting? You can register in person at any early voting site and on election day at your voting location. Voter registration: who is allowed to vote in Maryland? You can find eligibility to vote information at this link. Did you know individuals with IDD are eligible to vote unless they are both under guardianship and found by a court to be unable to communicate a desire to vote? Register to vote at this link. Check your voter registration at this link. How to vote: learn more about mail-in voting or request a mail-in ballot at this link. Find your polling place, your voting districts, and your local board of elections at this link. Information about access by voters with disabilities at this link. Did you know you can bring any printed material, including your marked sample ballot, to help you vote? We've used the following sources for this voter's guide: Disability Rights Maryland, Maryland Developmental Disabilities Council, the ARC Maryland, the ARC US, National Down Syndrome Congress, Maryland Board of Elections. The Maryland Down Syndrome Advocacy Coalition, MDAC. Mission: the Maryland Down Syndrome Advocacy Coalition advocates for laws, regulations, and policies that improve the quality of life for people with Down syndrome, as well as the family members and professionals who support them. You can contact us by email, marylanddsAdvocacyCoalition@gmail.com, on Facebook, Maryland Down Syndrome Advocacy Coalition, Instagram, Maryland DS Advocacy Coalition. Join us. This is the link for the MDAC member registration.
Questions for candidates. Do you support increased early intervention budgets in Maryland? Do you believe children with disabilities should learn and play alongside children without disabilities? Do you think the Individuals with Disabilities Education Act should be fully funded at the federal level as was promised when initially passed? How can we support general and special educators working together to create school communities and classrooms that provide the services and supports needed by all students to be successful, and sufficient professional development to school staff to be able to accomplish this work? Will you stand with advocates who are seeking strong policy guidance and/or a legislative solution to prohibit local school systems from supplanting rather than supplementing local funds with blueprint funding for special education? When parents disagree with schools and need to utilize due process procedures, do you think the burden of proof should be on the parents or the schools? Should parents be required to pay expert witness fees when they use an expert witness in a due process hearing? Do you think that all people with disabilities should have the opportunity to work at a real job with competitive wages? What would you do to increase work opportunities for people with disabilities? Would you support studying this problem to identify solutions to increase access to mental health care for Marylanders with IDD? Do you support increased funding for HCBS and stabilization of the direct support workforce? How can we ensure that these efforts to restore and protect the ability of people with Down syndrome and other intellectual disabilities to make choices about their own lives are successful? Do you support the mission of the Ethan Saylor Alliance and the further development of policies and programs promoting fair and equitable treatment of people with disabilities when interacting with law enforcement and criminal justice systems in Maryland? How would you hold MTA accountable for addressing these failures and living up to our state's commitment to people with disabilities?